A very warm welcome to you from Equa Marketing. This presentation is brought to you by Equa.com, a leader in digital marketing.
Hello everyone, welcome to another episode of Growing Dentist. Today I'm very excited because I have Dr. John Palmer, someone I have known for more than 5 years and I respect a lot, on the call today to talk to me about his journey with regards to growth. Hello Dr. Palmer, welcome and
Hello,
thank you for
Naren.
being here today.
Oh, thanks for having me. It's an honor.
Thank you, Doctor. Why don't we introduce you to our audience? I have known you for more than 5 years, of course, as a client, and I've known you throughout the years because we both belong to an association called IAOMT, and we have met each other several times and have worked on several things together. So for those of us who don't know you as much and your background, why don't you take a few minutes to, tell us a little bit about yourself?
Well, I started practicing dentistry in 1983, and I practiced like most dentists do, placing amalgam fillings, taking them out, doing routine restorative dentistry. But it only took me about 7 years, and I came down with mercury poisoning, diagnosed by a medical doctor. I had a lot of the symptoms, and that kind of changed my scope of practice. I finally found the IAOMT, which taught me how to protect myself and a lot of things about mercury that we weren't taught in dental school. But in that time frame of about now 15 years, I had been to the Las Vegas Institute. I'd, increased my clinical skills. I had a large cosmetic practice at one time. And as I became more knowledgeable about mercury and put things in place to protect patients and myself, the demand came for those kind of services from patients. My practice shifted from a cosmetic type practice to a holistic type practice, serving those kind of patients who were seeking extra precautions when we dealt with mercury. Throughout all those years, I had growth every year, except 1 year I was flat, just had almost the same exact numbers. And in the last 10 years, we've actually grown 116% over the last 10 years.
That's exciting. I mean, you've been practicing for a long time, but you have grown in that entire time.
Yes.
Why don't you kind of take us back to your early days as a dentist and reflect on how you looked at the world, with regards to time, money, relationships, and purpose. Like, how were you thinking when you just got out of school and you just started getting into dentistry?
Well, I can tell you I was very lucky because some people took very good care of me because I didn't have a clue about how to run a business. I actually graduated from dental school in 3.5 years instead of 4, so I was getting out and starting to practice in January. I had an old friend that was a banker, and he wanted me to come to the small rural town in South Carolina, and he basically financed me 100%. And my father put a small CD at his bank as collateral. He found me a builder. I built an office back in '83 and 2 rooms for $53,400, and it was completed before I even took my boards. It was just sitting there waiting on me. I was so naive, I had no clue that I might not pass the dental board the first time I took it. So that's how we got our start. I didn't have an interest payment for 6 months. My wife and I had $400 in the bank, and I sold a little catamaran sailboat that we had down in Charleston while we were in school, and that was our rent money every month. I financed it to some guys I knew. And so the first year in practice, I think I made $20,000. I netted $20,000. And we thought, in '83, we thought we were doing pretty good. But anyway, it continued to grow from there. I added chairs and got a hygienist and some more employees. And next year we did better, and it just continued. I stopped about 3 or 4th year, I did get some practice management help for some consulting companies, and I pretty much used some consultants periodically through the 30-plus years I've been practicing that have helped me grow the business, and you've helped me grow the business. And I have just found over my career that I'm real good at doing dentistry, and I'm not real good at doing things I don't know anything about. So when I figured that out, I sought other people to help me do things I wasn't good at. And that's really, I think, where my growth has come from. And you kind of start there, and then you start getting valued team members and getting them trained to take things off my plate so I can do the dentistry. And I think that's been one key to my growth over the years.
Yeah, I want to pick up on a couple of points you made. It's the first thing that out of your mouth was, I'm so lucky. I've known you for more than 5 years, and every time I've met you and talked to you, I get the sense that you are a very grateful human being. You always are so grateful. You're grateful for life. You're grateful for everybody around you, and you let them know that. And I think they appreciate that about you, and they work harder for you because you're that kind of a person. Is that sense of appreciating people and appreciating life, is that something you kind of learned along the way, or is that something, I don't know, maybe you learned from your parents? Like, I'm just trying to figure out, because at least in my case, I guess even now I have to work on it. I sometimes forget of all the things that are going well for us, and that I need to be appreciative of. But I mean, you are somebody who exudes appreciation all the time. So I don't know.
Well,
just would like to hear your thoughts on that.
I think I do have to work on that a little bit, especially with the people I work closely with every day. It's in the heat of the day and seeing patients, I may not always mention something when I spot them doing something good, but we try to do it in morning huddles and morning meetings. Like, we had just a huge day yesterday, and I was just real complimentary of everybody this morning. But you always need to recognize the good things. The people who work for you want to be recognized in more ways than just money. They really would like to know that they're pleasing me as the boss. And I tend to forget that sometimes, I'll be honest, I do. And what I meant was, when I was lucky, I don't really believe in luck that much, but the circumstances and people who I knew and guided me in my really earliest years for absolutely no payback at all, those people were very important in my life and helped me succeed to where I am today. God
partly maybe there. Because, again, I'm speculating, partly maybe because they liked you, like nobody likes somebody who's all about me, right? Usually people like to help those who help others. So I bet,
well, I mean, and that's,
even though you might, go ahead.
That's a natural thing. I mean, a dental practice is really not about dentists at all. The dental practice is about the patients, or in my practice, we call them guests. We don't even refer to them as patients. And we treat them like guests that would be coming to my home to be entertained or to spend a night, whatever, just guests in my home. And I don't know if that's part of being Southern. I mean, Southern hospitality, it comes naturally because I was raised that way. But that's the culture that I've tried to develop the whole years of my practice. If what we're doing creates value for that patient, then what we're charging, they're never going to complain about. And creating value is making them the most important thing while they're here, not us as me and my team. The only reason we're here is to take care of those guests. And the only reason we're going to succeed if we take care of it and create value for them. And they'll pay us, and we'll have financial gain. But if you focus on the guest and don't focus on all the other little things that can be going on around you, then you will have a successful dental practice. I really believe you will.
Right. That's an excellent viewpoint, right? So first, you look at them as guests, somebody who's here to be served. Second, you talk about creating value for them. I would love to hear more about two things. One is, how did you create that mindset? Yes, you have it, but how did you create that mindset or the culture in your team? And then, how do you go about creating value for them? And how do you help your team think about that?
Well, we actually consciously do training with our team on those concepts and those the things we do to create that. It's intentional. It just doesn't. We don't just hire somebody who has a pretty smile, who's nice. We actually do trainings all the time on how to take care of our guests better. My office is a little different than a lot of dental offices. When you walk in the front door, there is no glass window or no barrier between the guest and the person who's going to be receiving them. There's just a nice office desk. And that person's trained to, if it's a new patient, to go ahead and call them by name, even if they're wrong. If we got one male new patient and one female new patient coming within pretty close time to each other, and they don't know them when they walk in, it's probably that new patient. And even if there's not that person, they'll just apologize and go, "I'm sorry, we were expecting so and so. What's your name?" Because that's probably somebody they don't know either. The girls that I have doing that, they know our guest names. They pretty much know all the current guests by name. They're great at remembering names. I'm actually horrible at remembering names, so they do that for me. I think the other thing to remember is, and that's just a small thing. It just starts from there and keeps going. Making sure they're comfortable in the chair. We provide music. We provide all natural sedation. We provide nitric oxide. Whatever it takes to make it a pleasant dental experience in that chair when none of them want to be. Blankets. Whatever it is that they want and will need to get through that appointment. So it's the best dental experience they've ever had. Because you got to remember, even if a patient says it doesn't bother me a bit, they're lying. It's no fun to be in a dental chair. So you got to create a comfortable experience for them. Another thing to remember is they didn't walk in your door because they did not want you to provide services for them. So generally, when we have a new patient coming in for a consult, we do a lot of listening to them as we're finding out what it is they would like us to provide. I let them do most of the talking, not me. And then I finally ask them, well, if it's okay with them, is it okay if I provide you with the best possible service I can, the best possible treatment? They always say yes. And so then I diagnose their treatment on what it would be if I were putting it in my mouth or my wife's mouth or whatever, and I do just the best. I don't do the best and the second best, just the best. And if they can value that and afford that, that's what we do. And if they can't, then we may talk about the second best. And that's kind of the way we've been doing it for a long time.
It sounds so simple, but I talked to a lot of dentists, and I don't think they have these mindsets. I want to kind of pick up on a few words you used. You talked about training. You talked about intentionality, right? Everything is done with intention, with purpose.
Right. Mm-hmm.
You talked about listening to your patients. You never tell them what they should have or they need. They walked in for a reason. So asking them, what do they want? How can we be of service? You talked about, once they tell you how you can be of service, asking their permission, can I give the best service I can? Can I take care of the best way I know how? And then not pushing them, but rather helping them, right? It's
exactly.
They are the guest. They are the person you are here to serve. Your team is here to serve. And then how can we be of service with that mindset? And then obviously they can't afford or, make your best solution work. What's the next best solution? I would love to kind of grab onto those words, some of the words and some of those things you said, and kind of hear your reflections on those. Like intentionality, was that something you just learned over time?
No, I will tell you, I picked all this up from people who knew how to do it, and I learned from them. Whether it was paid consultants or some dental colleagues I've been close to over the years that I met through Las Vegas Institute, or even some of them I was in school with, and we took a lot of courses together, practice management courses. We took a lot of Las Vegas Institute courses together. And I'm just being around people smarter than me is where it came from. But Bill Dixon was the first person that really stuck this into my brain. He says all the time, he says, you don't know what you don't know. And if I've seen young dentists, I've seen associates come through my office, and they act like they know everything in the world. And if they would just sit back and realize that you don't know what you don't know, but there are people out there who've done it before you and that you can learn from, you should always be open to learning. And I've always taken new courses, even clinical courses or practice management courses. And I never sit back, or I'm reading a book, I never sit back and think that I know it all.
Right.
And every time I think I know it all, I find out really quick I don't know it all.
Right.
So that's been real key to our growth. I mean, even now, this year, we're adding clinical things to the practice. I mean, we're looking at going into sleep dentistry, working on that. We've got this early intervention orthodontic program called Healthy Start, which is just amazing, and it's starting to add to the practice. So that was one of those things that I didn't have a lot of interest in, was orthodontics, until I saw this Healthy Start program and learned about it. And it looks like it's going to add a lot to the practice.
So this idea of learning and continually learning, I mean, if is anybody who can say, I know it all, you should be one of them, because you've been doing it for so long and you've built this amazing practice over from 83, so over a 30-plus year period.
Mm-hmm.
But you feel that mindset of, knowing that you don't know it all allows you to notice the mistakes, notice areas to improve. And it is one of the reasons you have come so far.
Yes.
And another thing you said, Doctor, in your early remarks, you mentioned one of the things that allowed me to grow so much is I realized what I'm good at, and I realized what I'm not good at. Right. And I have been able to find people to do the things that I'm not good at.
Correct.
I want to kind of go a bit deeper into this. Can you expand on this, explain this to us more?
Well,
we're talking to, go ahead.
One of the simplest explanations of that would be take marketing. I have no background in marketing at all. And when we first started to actually market our practice and advertise, whatever you want to call it, we spent money that didn't get much result at all. And then the internet came along. And I know nothing about computers and the internet. So one of the smartest things I did was hire you. I mean, you made our new patients numbers go up incredibly from the internet, from what it was doing. So, like, marketing's totally out of my realm. I don't touch it at all in my practice. I have a gal as my marketing director who works with you. She works with print and does other things, and I've gotten her some training from practice management people that have marketing training. And when a marketing person calls, I don't even talk to them. I say, you're talking to the wrong person. Talk to Celia. She does my marketing. And if she says she wants to do it, she gets to do it. She has a budget. She doesn't have to come to me to ask. As long as she stays within her budget, I don't micromanage that. When you're first starting out in dentistry, you're kind of into this time and effort economy, where the dentist is the producer. You're the, nobody else can help you produce. You don't even have good people yet, and you start putting a team together. But if you micromanage that team or don't train that team or don't let them reach their full potential, you'll stay in that time and effort economy. And basically means that you got to have your hands in everything. You got to do every decision. You got to have your hands in. You can convert that over time with training to a results economy, where you come in and do what you want to do. I mean, for me, I like to be chairside, so I want to keep my hands on the clinical side. I can train my team to self-manage this practice. I have an associate now. I really don't have to be here, and they'll still have a decent day. And that's when it gets to that point, dentistry, because you'll go into the time and effort economy, you'll get burned out. Dentistry may not be as fun. It may be disappointing to you as a career. But if you can flip it and get into that results economy, you're doing it when you want to do it and you're doing the parts you like to do, dentistry gets exciting again. You probably won't be thinking much about retiring and getting out. But that takes time, that takes effort, that takes intention to do it, and you probably can't do it by yourself. You need to find a good consultant who can help you get there. At least for me, that's what happened.
Right.
Every time I've used a consultant, I've had a jump in my business. I've had a few bad ones that didn't last too long, that I separated real fast from, but that hasn't been many. But almost all of them that I've kept long term, we've grown the business through taking their advice.
Right. It's interesting. So most dentists learn a skill at school, how to do dentistry. They really don't know how to run a business. And I guess they start with the mindset of, I have to do it all, partly because of necessity, because they don't have the money to have a team and so forth. Mm-hmm. And then they get stuck in that mindset, and then they work harder and harder, hoping that one day it's going to become easier and easier, but it never does. And they get caught up in this trap. And now you're saying you can break that trap and you can go from time and economy to, where you sell time for money, to you are the owner, you are creating results, and people pay for results. So you don't have to do all the work. You can have other people be part of the solution. They can grow, you can grow, the practice can grow, and patients are happier because everybody who loves what they're doing is doing their piece.
Mm-hmm.
That's amazing. And
you can max out how much you can grow. Some of that depends on your space and equipment. I mean, you can only do so much with if all your chairs are full all the time and you don't have anywhere to expand, then you're gonna level off. So you might need a bigger practice. Or if you plan on bringing an associate in and you don't have room for them, you might not can reach that associate might not can reach their full potential. So you got time and space factors that can limit growth. But I think the biggest thing that limits growth is just our not having a vision of growth, not having a plan or goal set, and not training your team members in bringing them into that vision and what they need to do to reach those goals that are set in that vision. And you can set time periods. I mean, you don't need to set short time periods like next year is important, but you should be looking 5 and 10 years out, especially when you're young.
Right. And that's interesting. So why do you prefer to set long-term goals? Is it because this way it doesn't put a lot of pressure on somebody so they can really imagine and be creative? I'm just curious.
Well, I think change takes time. You can't walk in and change everything overnight in your practice and expect people to be happy. But also some of the long-term goals to really, say you want to grow to a $2 million practice. That might include having to change your location. And so you might have a 10-year goal. You might have to build a new building. You might have to save a little money before that. So there's all kind of factors that are involved in there. But you got to know where you want to go and kind of work backwards to get there.
Right. So you have a you visualize the future you want, and then you work backwards. Say, okay,
right.
This is where I want to be in 5 years.
Right.
And for me to get there, here is, step one. Here is step two, and not just for you, but even for each of your people, they have to go with it.
That's right. We're doing next Friday. We're having a strategic planning day that we're meeting, taking them to lunch, have some fun. But then I'm laying out basically a plan for the next couple of years. My time's getting shorter because I'm 60, but so I don't have 20-year goals anymore for the practice. I doubt if I'll practice till I'm 80, but I might do a little bit till I'm 80. That doesn't mean I can't still be present in the practice and doing things I like to do. Just may have some other doctors working for me.
Right. Let's switch gears a little bit. We have been talking about growing a practice, from an economic sense, right? Now, I assume as you grow, your definition of success probably has changed. What I mean by that is, at the end of the day, we all want happiness, right? That's what drives humans. So what brings you happiness, I bet, has changed. I mean, obviously there's money, there is time, there is purpose, there is relationships. I would like to kind of weave in and understand how you're changing, evolved over time about those things, especially time, purpose, and relationships. We have talked a lot about revenues and growing your practice. And again, even within relationships, there's the patient relationships as well as your team relationships. How do you think about those things, time, purpose, relationships, and how has it changed?
Well, my belief, I'm a Christian. So I try to keep that forefront. As I've become financially successful, it's been a lot easier to focus on, I guess, just well-being, having an impact on them so that they're healthier. I don't have to look at them like they can say yes or no, and it really doesn't matter at this point in my life. My family, luckily, I've always had a great relationship with my wife. My children growing up, I would tell you I spent more time in that time and effort economy that I wish I hadn't had to do back then. Luckily, they still love their dad and the grandchildren, and we all get together all the time. We've got a great family. But I would get out of that time and effort economy as quick as you can if you're a young person with kids. And I'll give you an example of what we did. And this was unfortunately after my kids were already in college. My team members came to me and they called me Joe. They said, Joe, how about let's try something? I said, what's that? They said, let's open at 7 in the morning. Let's work till 2. We'll skip lunch. That's about the same hours we've been working, and we can be home in time to pick our kids up or when they get home from school. I sat there just kind of dumbfounded, thinking how stupid I was. I looked at them and I said, that's the smartest thing I've ever heard y'all come up with. I said, but the only problem is, why didn't you tell me that when I had kids in school? And that's one regret. I wish I had done that when my kids were in school. Because we went to 7 and 2 and became more productive. It doesn't make any sense. Our numbers went up. We started doing that and skipping lunch. So we've done that for 10 years now, maybe more than that. I think 13 years we've had those hours, and they've still grown.
Wow.
So that was an incredible insight that they came up with, and so, but I really wish I had done that, because then I would have been those, baseball games that I wouldn't have missed, and those wrestling matches I might have got to the whole thing for. Those kind of little things would have been cooler. But I was still pretty much in that time and effort mindset back then.
That's amazing. I bet this change you made probably changed the relationship your team has with you, right? Because, I mean, who doesn't like to have a job where they get to go home at 2:30 and spend the rest of the evening with their kids?
Oh, yeah, I've got people who've been with me, close to 20 years, 10 years, and I've got people who've been with me 4 months. And they all love those hours. I promise you they do. It's really good for them. Some of them don't have kids yet. Some of them real young. So we've been pretty good maintaining long-term people. People have worked. They're definitely, a long time, very loyal, and then even the newest members have. In fact, I probably think I got the best team I've ever had right now. There are no people who are negative in this practice right now. It's just so great to come to work.
Right. That's very insightful. And I have 2 young kids, and you're just giving me an idea. I think stopping at 2 o'clock. I'm just wondering, I start early too.
That might be the best tip I've given on all day on this call.
Yeah. I mean, why not, right? Because you're still doing the same hours. It's just that you're shifting it.
Shifted a little bit.
Right. And you're right. I think even I have a 14-year-old and a 10-year-old, and if there's one thing that I wish I had done differently was spend even more time than I have spent in the past, just because you cannot get those times back, and kids grow up, and a 6-year-old is different from a 10-year-old who's different from a 15-year-old. So if you miss that 6-year-old, you miss that 6-year-old.
And if you're lucky like I was, my wife didn't have to work, so she was doing all the carpooling and driving those kids around and whatever, but she would have loved it if I could have helped out a little bit with that, a little bit more than I did.
Right. Oh, that's amazing. Yeah, I'm just thinking, you give me some amazing ideas in this call. In terms of, you kind of mentioned something else I want to pick up on. You said, sometimes when people say no, it doesn't matter anymore. In the sense, you're here to serve them. You're doing your best work with your best people, and you're enjoying every minute, every day. And the ups and downs of what happens in each situation doesn't affect you anymore. It's almost like, you have a purpose and you're fulfilling your purpose, and you don't really care about the ups and downs of every word that comes out, every situation. Is that something that you kind of matured into? Or how did you come to that realization? Because I bet it gives you a sense of calmness, sense of peace, sense of, how do I put it? Like a happy person to be around, who's not agitated by all those.
I don't tend to dwell on the negatives or, worry about the problems too much. I mean, things that I can't control, I don't really let bug me. But as far as guests and, I'm talking about saying no to the treatment that you suggested, I just feel like if I've listened to them, spent some time with them, heard what they wanted, and gave them the best plan to get what they wanted, then the reason they're going to say no is they either don't trust me, which I hope that's not going to be the case after the time we spent with them, or two, it's going to be financially. And I can choose to give treatment free to some people, but I have to choose that. I don't want them choosing that, me do it and then they not pay me. That's not going to happen. So if I've done all that, then if they say no, then all I say is next. Who's the next person we get to talk to? I've done what I was supposed to do. And I've done that to the best of my ability, and that's what I can control. So I can't always control the response sitting across the desk from me or sitting in the chair. I can't control that. I can just try to be honest and provide the best, and if they want the best, they say yes, that's great for everybody. If they can't afford it, then that's okay too, because I did my job the way I was supposed to do it.
Right. Another point you mentioned, and I've seen this with some of my best clients, they don't dwell on the negatives. They try to look for the positives and they build on it.
Mm-hmm.
And you mentioned, what's the point of worrying about something you have no control over, right? I mean, if somebody has financial issues and, how you don't have any control over it, So what's the point even of worrying about it, right?
Well, worrying never got it fixed. So,
right.
I mean, I'm not telling you I'm perfect and I don't worry about some things, Somebody's having a health issue in my family, I'm not going to totally ignore that. But I don't dwell on the negative too often.
Right. Right. So even if you do worry about it, you're worrying at it from a point of view of what can I do to improve the situation, not from the point of, it brings you down and you are a unhappy person to be around. Yes. So that's the fine line, right? How do you, even in a problem, you see a challenge and an opportunity, not the negative side of it, the emotional negative side of it.
Correct.
Let me talk about the relationship you have with your patients. Now, you have been doing this for a long time. How do they see you, and why do they see you the way they see you? Like, if I were to talk to somebody and about you, what do you think they will tell me, and why did and how did that come about?
Well, I don't think it's totally me. I think it's the whole package. From the physical looks of the office to the treatment they get from me and from my team. I mean, it's just they spend the fewest time with me. I mean, I might be by the time I walk in the room, they may be watching a movie with headphones on or using Newcom and blindfolded. They could care less if it was me or an associate that sat down next to the chair and worked on them. I do think they think I'm an authority as far as the Mercury issue and those kind of things. I mean, they've been on the internet, they've seen stuff. What they get from my website, it establishes you as an authority. That's what it's supposed to do for anybody's website. I mean, you're the dentist. You're supposed to know what's best for them. That's why they came to you, and if they don't trust you, they'll go somewhere else. So there is definitely a trust developed, but it's just not because I'm this great-looking hunk of a guy or anything like that who walked into the room. It's because of the whole atmosphere in the office, the whole culture that's developed here. It develops that trust. I mean, some of them might not even recognize me walking down the street. They haven't seen me with normal clothes on and don't have loops hanging off my head and all that other stuff.
Right. So you're saying it's the entire experience that yes. Makes it special. It's like an orchestra. You play your instrument, but there's a team and everybody plays their piece, and that environment where they are being served, they are the guest. everybody's there to serve the guest.
Yes.
That's what they like. That's the experience they keep telling their friends about and coming back.
That's what makes them write a review online, or that's what makes them refer some of their friends or family to us. It's the whole package.
Right.
And every performer is important.
Mm-hmm. Right. I understand. I like the
I
word.
mean, if they just flat love me in the back, and I'm talking to them, and I go out to my front desk to check out, and somebody's just a jerk to them, that would blow the whole thing. Or if there's confusion about what things cost because something wasn't gone over properly, that can blow the whole thing. Or if we go back and that day we do more treatment than they expected, without their permission, that would blow the whole thing. Every part of the puzzle is important to keeping those guests happy and referring.
Right. It's kind of interesting. I would like your comment on this, but as a student of marketing, I've been thinking what marketing is and what business is. And the more I thought about it, I came to the conclusion that marketing is about growing confidence. And there are lots of ways to grow confidence. Obviously, when you do things consistently, that grows confidence. When people see you again and again on Google, that grows confidence because consistency, right? Trust transfers and grows confidence.
Mm-hmm.
So, somebody trusts you and, let's say we post something on social media where they're holding a sign saying, "My dentist rocks," and, all their friends see it. Now, all their friends have confidence in you because, without even realizing it, there was a message that they're seeing where their friend trusts you. So, and I assume you have the same mindset in the office, right? Every interaction, you're asking the question, is what I'm doing, is what my team is doing, growing the confidence a person have in us, in our team, in our practice. Because if it grows confidence, they're going to do things, that's positive, right? They're going to accept treatment, they're going to tell their friend, they're going to write that review. But if it detracts, they're going to do just the opposite. They're going to leave, they're going to badmouth you, they're going to do, things to hurt your practice.
Correct. And there's a different way, I think, to communicate with different age populations.
Right.
Patients who are my age, they might not be as likely to go on their line and write a review if we ask them to. But the millennials and youngers, that's the way they communicate. And that's the first place they go to.
I would like your take on millennials versus baby boomers, for example. How do you see, as a dentist, as a owner of a practice, how do you see kind of catering to them differently, before they even get to know you and then in the practice? I would love your thoughts on it.
Well, as far as I make up my team, we kind of start young, and we have probably every generation in here, pretty close. But the youngest gals can communicate with the youngest patients pretty easy. But they also have different service desires. I mean, the millennials may not have a mouthful of restorations that are going to wear out and have to be replaced. They may have more desires for cosmetics or clear braces, or they may have sleep issues that are going unrecognized. They may have some myofunctional type issues, tongue thrust and breathing problems that can be corrected with a myofunctional therapist and a simple frenectomy. So they still have dental demands or services that are available to them if you recognize what they are. And that's one of the things that we've have trained over the years and have put into our practice, and I think that segment of population, we see that those needs for them. Whereas, the baby boomers, we all grew up with cavities and amalgams in our mouths and big restorations that need replacing. I mean, they're wearing out, so they have to be replaced. And those patients are ones that seek more, porcelain restorations, more of the high-end dentistry on the restorative side. And then that's about probably all I know about these generations, because that's why I hire you.
Right.
As far as marketing and going toward, what message do they hear, how they hear it, we need to ask you that question, Naren, not me.
No, absolutely, yes. Yeah, I mean, I find there's a generational difference. Like, the baby boomers, they like that personal touch. I mean, for them, that handshake means a lot.
Mm-hmm.
Now, the younger millennials, I mean, I read some quote somewhere, they trust strangers more than they trust even institutions. I mean, the trust that people have in the U.S. Congress is like 13% or like really low.
Yeah.
But on Airbnb, they go and sleep in somebody else's bedroom who they have never met,
Mm-hmm.
right? So I think the young people are, because they were brought up in a very different way with these devices and, connected to the entire world in their fingertips all day long. So their view of the world is very different from, the older generation, and it translates into how they behave and how they do things. Yeah. Now that you are 60 and, you are at a phase in your life where you are prioritizing time more and you are doing the things you enjoy doing, and you're trying to build a team and, going from that time and economy world to results world, how do you see your future? Like, how do you think about it? Do you feel confident? Do you see changing in terms of the amount of work you're doing and the kind of work you're doing? I'm just curious.
Yeah, I mean, I had an associate about 3 years ago, straight out of school, and I kind of see probably maybe adding another associate and letting them do the procedures I really don't like doing or don't have to do. The
Right.
occlusal composites or the class 2 composites, that quadrant stuff. And then I can probably drop back to about 3 days a week, chair side, maybe 2 some. And I can still put in the porcelain implants or those kind of things, do some sleep dentistry, maybe some healthy start stuff. It's real easy. You have to sit down chair side and do that kind of stuff. And let them do more of the restorative work. And then I'll still be in place to lead the practice, do its vision, manage some, create a team that can manage, and then you got to practice that I don't have to be here all the time. And it will still,
right.
I'd like to leave a legacy of this practice. I'd like to leave, hopefully it will survive after I've retired from dentistry. Either I'll own it and have people working, or they'll eventually end up buying it from me. But one of the problems is with kids coming out in debt like they are from dental school, they really don't have the option of going into practice for themselves because it costs lots of money to open a dental practice, and they're already in debt. So the banks don't want to loan them any more money, so they have to go to work for somebody for a while. It wouldn't. I would hope one day I'll have some associates that will say, "Okay, we're ready to take this over, and we'll buy it from you," and that would be okay too. But I'm planning on working till I haven't picked a quit date yet, Naren. I just know it will be someday. Somebody out there, I will quit, but I can't tell you when it's going to be yet. It's still fun.
Right. Yeah, because you enjoy what you're doing, right? So why do you want to quit in the first place? I mean, people retire supposedly to enjoy life. If you're enjoying your life right now.
I'm in good shape. I'm working out 3 days a week with a trainer, so I don't have any health problems currently, thank God. So as long as I'm healthy and I'm having fun, I'm not planning on just quitting. But I also have always had the theory that the reason you work is so you can go enjoy life. You can go have fun. So,
right.
I
really enjoyed our conversation.
I have too.
Thank you very much, Doctor, for your time today and, helping our audience and our listeners learn a lot of valuable insights. The things that stuck out in my mind, it starts with appreciation. It starts with, teamwork, where you appreciate people for their strengths and realize your, strengths, and then figure out how to empower them to do what they're good at while you do what you're good at. You talked about learning and always learning, having that mindset that there's a lot that I don't know, and always willing to, work in that mindset. You talked about shifting from time and effort, where you're trading time for dollars, to results-based environment. You talked about the guest, your patients as guests. You serve them. You ask them what they want. You ask their permission on, can I give you my best care, and then let them pick and choose your best care or your second best care. You talked about they don't come for you. Maybe when you were in the time and effort economy, yes, maybe they came for you, but now they come for your experience. They come for the overall experience, where they're treated as guests and taken care like guests, like Southern hospitality you talked about. You talked about, you don't really get caught up in the ups and downs of the day-to-day, especially the negatives. Yes, we all feel bad sometimes, but you try to get out of it quickly, and you try to, focus on the positives, and you build on it. So I learned a lot today, Doctor, and I think many of the listeners, especially people who haven't had the experience you have had, will get a lot of interesting insights if they listen carefully and pay attention to what you're saying. So if anybody wants to learn more about Dr. John Palmer, just Google Dr. John Palmer, South Carolina, and you'll find him, and there's tons of information. Once again, thank you very much, Dr. Palmer. I really appreciate having you today, and for sharing all your wisdom with all of our listeners.
Thank you, Naren, for having me. It was fun. I had a good time doing it.
Thank you very much. Appreciate it.
You're welcome.
Once again, thank you for listening to another episode of Growing Dentist.